When someone's heart stops, every second counts. You can make the difference between life and death by calling 911, starting CPR, and using an automated external defibrillator.
In the next 5 minutes, this video will teach you what you need to do if someone around you collapses. You can help save a life. All you need to do is lend your hands. I'm Dr. Amr Aldeen.
And I'm Dr. George Champus. We're the directors of CCARES, or Chicago Cardiac Arrest Resuscitative Education Service, in the Department of Emergency Medicine at Northwestern University and the Feinberg School of Medicine.
When someone suddenly collapses and their heart stops beating, it is known as sudden cardiac arrest. In the United States, about 1,000 people every day suffer sudden cardiac arrest outside of hospitals, at home, at work, and in public places. The chances of surviving sudden cardiac arrest go down by about 10% per minute if no one acts. In other words, victims of sudden cardiac arrest have only about 10 minutes before survival is virtually impossible. These first 10 minutes are absolutely critical, and anyone can help improve that chance at life.
Survival can be increased by several factors: early activation of emergency medical services by calling 911, early performance of cardiopulmonary resuscitation or CPR, and early use of an automated external defibrillator or AED. This video will show you how easy the proper methods for CPR and AED application are, so you are prepared if someone suffers sudden cardiac arrest around you.
CPR has been the cornerstone of sudden cardiac arrest care for decades. Traditional CPR involves a combination of assessment, mouth-to-mouth ventilation, and chest compressions. Traditional CPR, when delivered properly, can double the chance of survival of victims of sudden cardiac arrest.
However, researchers have found that only 1 out of every 4 victims of sudden cardiac arrest receive CPR by others who witness them collapse. Why is that? There are many reasons, but most people don't want to do mouth-to-mouth ventilation and are afraid of causing more harm by doing CPR.
Is there a way to provide good CPR without doing mouth-to-mouth ventilation? According to the researchers from the United States and around the world, a new technique called hands-only CPR has been shown to be as effective at saving lives as traditional CPR. In hands-only CPR, there is no mouth-to-mouth ventilation. All you have to do to help save a life is chest compressions.
Hands-only CPR is easier to remember and easier to perform than traditional CPR. When chest compressions alone are done properly, the chance of surviving sudden cardiac arrest is doubled.
How do you perform hands-only CPR? If you see someone collapsed and not responding to gentle shaking, place your hands on top of each other in the center of their chest. Interlock your fingers, keep your elbows straight, push hard in the chest, and let the chest come back to its normal position before starting again. How fast do you perform chest compressions in hands-only CPR? The optimal rate is 100 compressions per minute. How fast is 100 compressions per minute? Think about the songs Stayin' Alive by the Bee Gees and Let's Get It Started by the Black Eyed Peas. Both of these songs have beats at 100 per minute. You can listen to those songs to get another idea of proper timing. 100 compressions per minute is pretty fast, faster than once every second. How deep do you push down on the chest during chest compressions? The optimal depth of compression is 2 inches. 2 inches is pretty deep. Generally, most people who do compressions usually don't go deep enough with their compressions. When you are pushing down 2 inches, sometimes you can hear the victim's ribs cracking. If this happens while you're doing proper CPR, keep doing CPR. You aren't hurting the victim. Just remember this: a broken rib will heal, but a lost life cannot. So if someone has collapsed and you have called 911, your first priority is to perform chest compressions, also known as hands-only CPR. That's right, you do not have to do mouth-to-mouth in order to help increase someone's chance at surviving sudden cardiac arrest. Do not do hands-only CPR in the following circumstances. Number 1, in victims who are children, i.e. those who appear less than 12 years of age, and number 2, in victims of drowning. In these cases, mouth-to-mouth ventilations should be performed in addition to chest compressions. The new Good Samaritan legislation signed by Illinois Governor Pat Quinn on July 18, 2011 protects any individual trained in basic CPR. You do not have to be actively certified in CPR to be protected under this new law. As long as you are trained to do proper chest compressions, you are protected.
What is an automated external defibrillator, or AED? It is a portable device that delivers a controlled electrical charge or a shock to the heart to try and restart it in victims of sudden cardiac arrest. That's it, pure and simple. The AED has no other functions. It does not do chest compressions, does not do ventilations, and it does not stimulate any other body organ. But in certain heart rhythms, it can electrically restart a stopped heart.
How does one use an AED? It's simple, and it doesn't matter what the AED looks like or what manufacturer makes it. They all use audio commands to guide you through the process of how to use them. Open the bag. Inside, you will find a small device about the size of a book. This is the AED. Press the on button.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
The AED will talk to you and guide you through the process of delivering a shock. Just listen to the instructions.
When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
Note the position of the pads on the chest. After the pads are properly placed, press the Analyze button and listen to the instructions. The Analyze button is marked with an I.
No one should touch the patient. Analyzing.
If the AED says shock advised, please stand clear and make sure that no one is touching the victim. When this is certain, press the shock button. The AED will not shock a person unless an abnormal heart rhythm caused their heart to stop. You cannot shock someone unless they truly need it. For example, if someone is just sleeping, you cannot hurt them with the AED.
Who can use an AED? The answer, anyone. Using an AED does not require formal training. The AED itself will guide you on how to use it. AEDs are often located near restrooms in public buildings, including airports, stadiums, convention centers and schools, and many others. They are marked with the signs shown. Don't be afraid to use an AED. It may just save someone's life.
Sir, are you all right? Somebody help. Let me call 911. Yes, someone's collapsed at the library. We need an ambulance. I'm going to put you on speakerphone and start compressions.
Hey man, how can I help you?
Can you get an AED?
Yeah, let me go find one. Hey, I found this by the bathroom.
All right. If you take over compressions, I'll start the AED.
Okay.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
If you can remember call, compress, and shock, then you've done your job to lend your hands and save a life.
Just like anyone can call 911 and anyone can do the Heimlich maneuver, anyone can do chest compressions and anyone can use an AED. You don't need formal training courses. You don't need to be certified. You just need to have the desire to lend your hands to help save a life.
This message is brought to you by CCARES, the Chicago Cardiac Arrest Resuscitation Education Service. CCARES, lend your hands, save a life.